And we definitely will be mindful of everyone's time, so we can switch these. Elizabeth, she runs a very, very strong program called Nature for All, and because she is not on yet, I definitely want to be mindful and respectful of your time. And so we will move on to the next agenda item, but I just like to say welcome, everyone. I'm Salaneka, our Director of Member Services, and welcome to our June LARCA Government Education and Engagement Roundtable. And because we are going to move down on our list, we are going to welcome Agnes Zsigovics. I believe that's how you pronounce it, Agnes, and she's the Community Engagement Manager for the Alzheimer's Association, San Diego Imperial Chapter. And as we know, June is Alzheimer's and Brain Awareness Month. It's also Men's Health Awareness Month and Men's Mental Health Awareness Month. Following May, which is Mental Health Awareness, we all know the importance of being aware of all of our cognitive issues. And so I want to welcome Agnes. We were able to get connected and cross paths recently, but not only from our professional careers as folks in the healthcare space, but also personally with ourselves and also with our family members and people around us. We definitely want to be aware of the signs. So without further delay, I'd like to welcome and thank Agnes for joining us.
Well, thank you so much. And yes, my name is Agnes, and Zsigovics is a really hard name, so no problem with the pronunciation. And I am with the San Diego Imperial Chapter, and that's because we do virtual sessions all over the country. But I do want to say that if you're interested in having someone come in person, maybe your board wants to have that, or the executive director wants for the staff, I can connect you with your local office that can help. Let's make sure that I am on time. Start. Okay. So I'm going to share with you my PowerPoint here, and it's going to start off with some statistics that I think you'll find pretty interesting. So where do we have share? Pretty striking. Every time I see those numbers, I go, ah. So all the numbers that you just saw in that video are on this slide. And maybe look around and see which one really sticks out to you. One that sticks out to me is 1 in 3 older adults die with Alzheimer's or another dementia. That's really a big number. And I want to point out that the nearly 13 million Americans providing unpaid care, that number was 12 million 1 year ago. I'm going to guess it's because the cost of, having care. So, families try to figure it out. But it's a big jump for us. Just a quick note, I want to point out that Black Americans are about twice as likely as white Americans to have Alzheimer's. Hispanic Americans, 1.5 times as likely. And this is a lot related with the women. It's a women's disease in a sense, because 2/3 of people living with Alzheimer's are women. And also the women are the ones that are taking care of folks with Alzheimer's. So not to, discount the men in the room, just really important that we look at it from a female perspective. A lot of people ask me, is dementia the same thing as Alzheimer's? What's going on there? And dementia is actually an umbrella term. It's like cancer. So there are different types of cancer. So pancreatic cancer, breast cancer. The same thing for dementia. There's a bunch of things below that. Alzheimer's is one. Between 60% and 80% of people with dementia have Alzheimer's. But there's also other ones, vascular, Lewy body, frontotemporal, and not only Huntington's, but what's missing there is Parkinson's. Do want to point out cognitive decline, which refers to changes in memory, thinking, and our reasoning that are worsening over time. Most of us, as we age, do have some cognitive decline. There are ways to lower the risk of cognitive decline. Hopefully we'll get to those as well. So Alzheimer's is a brain disease. It affects your memory, thinking, behavior, and symptoms, grow severe enough to interfere with daily tasks. And it's problems with memory, but then it leads to the need for 24/7 care. So it's a progressive disease. Symptoms gradually get worse over a number of years. And unfortunately, we don't have a cure at this moment. just so you have an idea what a healthy brain and advanced Alzheimer's brain look like. And you can see the neurodegeneration and the atrophy and that small on the right. And the little comment here on the bottom I'm gonna look on for this slide is those 20 years where you're asymptomatic, your brain, there are changes that we can detect that let us know that you're headed down that road. So these are lots of things that we're working on. Then mild cognitive impairment, then mild, moderate, advanced forms of dementia. How do you figure out do you have Alzheimer's? For many years, we had to have after death an autopsy to find out that it was Alzheimer's. Now we can do a PET scan. We can do a spinal tap. But interestingly, we can do a blood test. Last year, in the summer, the FDA approved a blood test. And there's a little, this and that with that. You have to learn a little about it, like only for 55 and over. Nonetheless, it's an amazing, development that we can actually have a blood test instead of having different, more expensive and more intrusive tests, right? So early detection. I would like you to pay attention to any changes in your memory, thinking, or behavior, because we need to find out, because we need to give you certain medications that will help, and they will only help in early stages. So, think about it yourself. If you think that someone else, a family member or friend, has some changes, talk to them. If needed, take them to a doctor to figure it out. And maybe it isn't Alzheimer's, but if a neurologist gives you a cognitive test, now you have a baseline. So 2 years later, when you feel like you're having more symptoms, you can go back, take the same test, and see what the changes were from year to year. So the treatments. I'd like to just jump to the first one that's listed. New treatments are available that slow disease progression for those in the earliest stages. These medications have been approved in the last 4 years. Prior to that, we only had medications that treated some of the symptoms, really masked things. It didn't look at the underlying biology and actually do something to slow the disease down. These medications, again, are only useful for people in the earliest stages, so it's really important to have early detection. And there's all kinds of drug and non-drug options, and everyone experiences Alzheimer's differently, so treatment may work in varying degrees and are not effective for everyone. Okay, this one probably is interesting to you all. These are the warning signs. And as I read these, try to think of someone with mental illness and how these symptoms are very similar to some that people are experiencing who have mental illness. So memory loss that disrupts daily life. People do not have to have all of these warning signs, but they usually have, for the most part, a memory loss issue. And, you can find that some easy way to find that out is somebody asks you the same question over and over again. What's for dinner? Chicken. They forget they asked you. What's for dinner? Chicken. And they keep asking you, and you keep answering. And unfortunately, you often get frustrated, and that's what I say to people is you really have to dig deep and just have patience and love to get through those moments of memory loss. Challenges in planning or solving problems, difficulty completing familiar tasks. Someone might forget how to use the microwave, for example. Confusion with time or place, which I can see, is linked, very similar to perhaps some mental illness. Trouble understanding visual images and spatial relationships, new problems with words, speaking or writing, misplacing things, and the inability to retrace those steps. So decreased or poor judgment, again, thinking about mental illness, there's a lot of, decreased or poor judgment. Let's say somebody is in a manic phase of bipolar disorder, a lot of poor judgment going on there. Withdrawal from work or social activities, something that often happens, for instance, for someone who has depression. And the last one, changes in mood and personality, that a lot of that has to do with mental illness as well. So you're looking for these things in yourself, and your friends and family, as well as the patients that you work with. Okay, here's how can I tell if someone I have on the line, because I had this slide for folks that are operators. Really, you can't be sure because some of these things, overlap. Ultimately, you're going to have to go to a doctor and figure it out. And either that's a neurologist or because of your work, most probably it would be a psychiatrist who can also deal with these issues. So someone who has problems with words. And this is an interesting one because somebody who has Alzheimer's might say something like, oh, I need to buy another hand clock for my hand. And that's because they can't remember the word watch, and they're finding ways to get around it to make sure that they get it out. Something similar would be, I need something from the refrigerator. Well, they say instead, I need something from the cold box for stuff. Come up with something and a way to deal with that. I don't know if I said this sounds angry, agitated, and combative and paranoid, but that's, again, we're going to look at that separately. So I found these, and let me make sure. This isn't actually from the Alzheimer's Association. I just did a little research myself. I'm a social worker that has worked with adult mentally ill patients, so I just pulled this together for you all. So the link between mental illness and Alzheimer's disease shares biological mechanisms where one condition can increase the risk of the other. So people with mental health issues have a higher likelihood of having Alzheimer's, and people who have Alzheimer's have a higher likelihood of having mental illness. So it goes hand in hand. Having a history of mental disorders significantly increases a person's risk of developing Alzheimer's and other forms of dementia. Individuals who experience depression, particularly later in life, have roughly double the risk of developing Alzheimer's, and severe or untreated depression can accelerate the onset of Alzheimer's by 5 to 7 years. Conditions like schizophrenia and bipolar disorder carry an elevated risk of cognitive impairment later in life, resulting again in an earlier onset of dementia. And the risk of Alzheimer's increases exponentially with each additional mental health disorder. So the more the different diagnoses you have, that will, add up. So Alzheimer's itself causes severe mental health problems. So we're trying to figure out, did one lead to the other? Are we misdiagnosing? Do we need to be looking at this more carefully for dementia? Here's something. It's really hard to figure this out, but I found this one. And dementia and mental illness, particularly in seniors, can easily be mistaken for one another because both conditions share symptoms like confusion, withdrawal, and memory lapse. Here are two things to kind of help folks out is mental illness does not typically damage motor or basic language skills, whereas Alzheimer's eventually does. That's a difference. People with depression often readily complain of memory lapses, whereas Alzheimer's patients are often oblivious to or indifferent to their memory deficits. That's a pretty easy one to look at. So here's some effective communication skills. Speak slowly and clearly. Use simple language. Ask one question at a time. Maintain a calm, respectful tone, and allow extra time for responses. And when you're giving people options, keep it simple. This or that. This or that. Not this. Just simplify it for them. All right, I'm going to make it. Okay, I'm going to keep going. I really think this part is important for the people listening to this, for you personally, your family members in your life, but very important for seniors that, need to keep their cognitive skills up. So we all deserve a healthy brain. And there are several factors of cognitive decline. Mostly it's age. And there are actions we can take to improve our brain health. So healthy living can lower the risk of cognitive decline and possibly dementia. And our brains need to be taken care of at all ages. Never too early to start, never too late to take some kind of action to protect your brain health. So again, on your top risk factor is age. So every single year you get older, every single year your risk goes up. Genetics, family history, those you can't change. But you can change certain take care of certain health conditions and do certain health behaviors. So here are the 10 that the Alzheimer's Association says are really important for us so we don't have cognitive decline. So there they are. I'm going to rush through them and let me know if I'm going a little too long, and then I'll make sure to leave time for questions. So controlling your blood pressure and managing diabetes. People who have diabetes are at a higher risk of cognitive decline. People who have high blood pressure are at risk for, cognitive decline. So you can participate in healthy activities like eating right, physical activity, exercise. And that's why this is on the same slide, is that we can do this by increasing physical activity. If necessary, medication is really good. Get moving. We all know that exercise and eating right is going to help us for a variety of reasons. Those would necessarily, that they're physiological, but you not necessarily think that they're actually going to help you lower your risk of cognitive decline. So engage in regular physical activity that raises your heart rate and increases blood flow to the brain, and find ways to build more movement into your day. I personally walk the dog in the morning, and at lunch, I eat my lunch, and then I walk for 15 minutes before I go back to work. And that's enough. You're going to find out that 30 to 35 minutes for 4 days a week will make a huge difference in people's lives. So we have maintaining a healthy weight. People who are obese have a higher risk of cognitive decline. It's really hard to lose weight, and especially if you're not sleeping well, because people who don't sleep well have trouble losing weight. So those two go hand in hand as well. Be smoke-free, protect your head, make sure you're wearing your seatbelt so you don't go through the windshield. If you're biking, make sure your helmet is on. If you have kids, make sure they have the appropriate equipment as well. And seniors have especially tough time with falls. They fall a lot. So any way you can prevent falls, especially for older adults, is really important. Stay in school. A lot of us have already gone through, our education. And those people now have, a lower risk of cognitive decline. If you had formal education for a long time, you stayed in school, then you have, a better situation. But you can continue your own education by going to a local college or online. Challenging your mind. I love to talk about this one. So if you want to go back to this, or if you want to have this part of the presentation in an extended format, then we can talk more about that. So there they are again. Just so you know, we are looking at all kinds of different things, hearing and vision loss, stress, dental care, and air pollution. The ADA has said people with periodontal disease have a higher risk of dementia. Really interesting. And lastly, we have the Pointer study, which was a large-scale study with 2,000 people who were at risk of cognitive decline, older adults, and they asked them to do all of these things: 30 to 35 minutes of moderate to intense aerobic activity 4 times a week. They asked them to do strength training, flexibility exercises. They asked them to do certain cognitive exercises, and they suggested that you participate in what is called a MIND diet, which mixes a Mediterranean diet with the DASH diet, which was created for hypertension. So I think really important, I would say here, is we have lots of services. We have a 24/7 helpline at 3:00 in the morning when your loved one is, doing some kind of behavior that you don't know what to do. Call them up and they will give you not only information and resources, but you can be transferred over and talk to a professional, like a licensed social worker, for example, about your specific situation. We have free education and support groups. Like today, I'm giving some education. Here in our area, we have 12 support groups throughout San Diego County and Imperial County. Okay, so I'm going to finish up. There's a walk to end Alzheimer's. I would love you to participate in that. tell you about it soon. These are our walks that are in our areas, but in your areas in the fall, there are also different walks that are closer to you. Just a quick note here. We're working on this. We have $405 million invested in 1,100 projects in 56 countries. Actually, here in San Diego County, there are $18 million invested. So we're really looking for a cure and hoping to find one. So I am going to, these go through again. Okay, so this is me. You're absolutely welcome to contact me, or I can connect you with someone at your local chapter. If you're calling at 3 o'clock in the morning, it's actually better to call the 1-800 number, and we'll put that in the chat. We already have alz.org in the chat, which is an amazing site. You can get so much information. And I'm going to move on to questions. Let's see.
Agnes, thank you so much. This was really informative and shocking. And I definitely have a couple questions, but I'd love to open it up to the members. Please, if anyone have a question or comment for Agnes, and thank you once again. Very, very informative presentation and shocking information. Any questions?
I do. I'm Desiree Alvarado. I'm on the LARCA board. I do have a question regarding the blood test. Is that, how accurate is that, and can we ask for that test with the primary care, or how would that?
Yes, so it is very accurate. They've tested it, so they've done the test and then they've done a PET scan and compared it to make sure that it works. People who are 55 and above and who have some sort of issue that, they think that you might have some issue with dementia, then you can have it. That's the way to have it. If you go to your primary care provider and you ask for it, they might get you. But unfortunately, primary care providers are not, they don't even know. My doctor, I have to tell my doctor that this exists. And primary care physicians, they don't diagnose you. They do feel uncomfortable doing that. They feel uncomfortable talking with you about dementia, and they luckily send you over to a neurologist that will give you a cognitive test. Sometimes a physician might say, "Oh, you know what? You're just aging, big deal." And they actually do that. So you have to advocate for yourself, push and say, "I want this test. Send me to the right place, and we're going to get this done."
Well, that's good to know, because I do have, a few clients that, I'm always concerned about them, and I can go ahead and advocate on their behalf about getting that blood test.
Yeah.
Thank you. Thank you so much.
Yeah, that was a great question, Desiree. Thank you.
Very.
Yeah. Barbara Wilson, another one of our board members. Hi, Barbara.
Hi, good morning. Thank you so much for this presentation. Question 1, will you leave your PowerPoint presentation with Salaneka for distribution?
Absolutely.
Thank you. And second, I just wanted to mention that I thank you for mentioning the overlap between mental illness and Alzheimer's and other forms of cognitive decline. One of the things, some of us come from the mental health end of things, and we are noticing the similarities between people that do blackout drinking and people who have serious mental illness like schizophrenia and cognitive decline and Alzheimer's. So we're really more and more looking at this, the thing about serious mental illness as brain disease, rather than mental illness, the kind of thing that the, media has promoted. So thank you so much for this tie-in. Much appreciated.
Oh, you're welcome. And to keep it, fresh in everybody's minds, someone who has mental illness, their likelihood of Alzheimer's go up, and someone who has Alzheimer's, their likelihood of mental illness goes up. So there were two other people.
Yeah. Anyone else? I thought I saw another hand. Maybe just fascinating.
I'm sorry, who said that?
My question was, I saw that, 2/3 of African American women, you said, or 2/3 of Alzheimer's are African American women, right? And that women in general.
Well, there's 2/3 of people who have Alzheimer's are women, and Black Americans are twice as likely as white Americans to get Alzheimer's. And there's a variety of reasons that that's happening, but we need to study of that. Particularly, Black Americans don't like or don't know about participating in clinical trials, so we can't really figure out things without having them participate.
I have one more question. Are there being studies done in countries that do not have
There are people across the globe that are doing studies, and you can think it's really easy and makes sense that countries that eat more fish, have leaner meats, vegetable Mediterranean diets, that those areas have lower incidence of Alzheimer's. We have a conference every year. It's coming up next month, and people from Japan, people from the bottom of Argentina, they all show up, and they all share what they're doing throughout the year.
I think it's interesting that you said depression is one of the larger factors, I think you said, that contributes to Alzheimer's. And when you think about that from an environmental and systemic perspective in terms of, tying that to poverty, tying that to, just the community where pollution could be a factor in your community. So many things really play into probably why the numbers are skewed that way. And the fact that women are 2/3 of the Alzheimer's cases, as well as being more of the caretakers of those who have Alzheimer's. That's really interesting as well.
Mm-hmm. It is. When I started this job, it's been 2.5 years, that they shock me all the time. Like, if I get more information, I'm shocked. And it's just, the speed that we're getting, all of this, like I said, these newer medications that slow the progression of the course. Didn't have anything before then. This blood test just came out last summer. So things keep coming out. And interestingly, you talk about pollution. We are doing studies on pollution. We have a study that shows that people who inhale wildfire smoke have higher incidence of Alzheimer's. So they looked at places we often have that, and they figured out that for some reason, the particulates in wildfire smoke are particularly, cause problems.
That's really something, Agnes. And, it just makes me think about what we're dealing with, the current non-wildfire, but pollution issues like in Boyle Heights, and just what recently happened in Garden Grove. You're saying that environmental issues can definitely play a part because we just don't know what we're breathing. So to tie that into Alzheimer's is once again shocking, but this has been so informative. I can't even thank you enough, Agnes. We want to have you back. And also for any of our members, anybody on the line, if you guys would want another presentation, more direct involvement with Agnes, or another session like this, please let us know. Reach out to Agnes directly or reach out to me, and I'm happy to facilitate it because this is such valuable information. We want to ensure as many members know about you and know about what the work you're doing is possible, and also more about the upcoming Alzheimer's Walk for our region here in Los Angeles County. You said in the fall.
Yes. Yeah. It's an opportunity. Yes, it's a fundraising activity. And we want people money. And if you raise $100, you get a t-shirt and all kinds of stuff. But if you don't want to fundraise, I suggest that you still go to the event, wear something purple because everybody's going to be wearing purple, and walk. There's more of you. You're raising awareness. People often after walking on the route that, why are you in purple? What's going on? And then we can answer questions right there and give them resources there. So if you don't want to fundraise, it's still a great opportunity. I haven't been to the one in Los Angeles County, but in San Diego, thousands of people go to the event, and it's really fun. Yeah. Barbara, did you have a question?
I did. I'm a treatment person, and one of the things that we notice is that when someone suffers from extreme anxiety, and that gets treated, their depression improves, and vice versa. if we treat the depression, we see that the anxiety improves. We don't know why. It just, similar to some of the comments that you made. And one of the non-pharmaceutical ways that we are treating that, it's promising practices, is not yet CMS approved for that particular thing, is neurofeedback, which is completely non-pharmaceutical and allows the brain to heal and recommit. I kind of taking your car in to get a wheel alignment. If you had a Ford Focus, you still have a Ford Focus. If you have a Maserati, you still have a Maserati, but it just drives more efficiently. And so we do that in our practice, and we see amazing results. And I'm only one person, so hopefully you can promote the idea of maybe a larger scale research project done using neurofeedback, because it's a lot easier for patients, do I say that word, clients to engage in that process than some of the other therapeutic techniques that require a lot of concentration and what you do with the eyes and this and that. They just have to sit there and kind of watch the screen. So it's a lot less anxiety producing. So I'd just like to see maybe something like that happen.
Well, what I do when people say, something that they'd like to suggest is I send an email to our MedSci team, and they're the ones who decide what's studied. So they'll look at it like, what evidence do we have so far? Is this something that we want to, put money into? The dental care, they haven't, we know that the dental care is there, but they haven't given money to study specifically that. So I will pass it up and see. That's a great thing to share with. Some people have been asking about supplements and how they can perhaps help that up the ladder.
That goes around about every few years. That was around in the 60s. About every 10 or 15 years. Mega vitamins. That's the cure.
Well, now somebody particularly asked me at my last session was, mushroom coffee. And I had, not going to be our focus necessarily is mushroom coffee. Thank you.
Thanks so much.
Yeah, we really, really appreciate you, Agnes. Does anyone have any other questions? Again, very, very informative. I'm just kind of still processing this, and I want to share the presentation with everyone on the call today, but also we will continue to follow up with additional information. And Agnes, you're welcome to come back if you ever have updates you'd like to share with us. And also for anyone who would like to have a direct presentation from Agnes for their facility, please let me know.
And I will send you a PDF version of the slides because it's too big to send. And I'll send you a link to the video so that you can still see the video if you want to go back.
Okay, great. That sounds wonderful. And thank you again. Yeah, very,
Absolutely.
very informative.
All right. I hope to see you at some point in the future.
Oh, and that was, me too. And I think just one last note from Barbara, wonder about the connection between trauma and Alzheimer's.
Well, particularly head trauma, absolutely. We know that the more concussions you have, the higher your risk of cognitive decline and dementia. Otherwise, as far as neurologic traumas, I am not familiar with that. It's an interesting question about what that looks like. But trauma sometimes leads to mental health issues, and then those could lead to Alzheimer's. So it all could be connected for sure.
Absolutely, especially the through line from trauma to depression. Yeah, so there could be a link. Yeah, thank you. Really excellent discussion. Thank you again, Agnes, and we definitely hope to have you back.
Okay, I will sign up.
Okay, thank you. Okay, everyone, that was really something. And we really appreciate, untreated trauma. And we know that a lot of women have a lot of untreated trauma just from, societal issues. So thank you very much for that. We did receive an update from Lisbeth, and she apologized because she had to go out on one of the trips. So a colleague called in. And so she's actually taking a group out now. So she's going to come back and join us. But what I want to share with you guys is, in case you haven't heard, Elizabeth Gonzalez Ruiz, she works as a program manager for Nature for All, and we will have her come back because this is an incredible program that is free for your residents and staff. We all know the psychological research that shows the connection of how when people spend time in nature, it can improve our mental health. It can sharpen our cognition. And so Nature for All is a program based here in Los Angeles County, which provides for about a 5-hour trip. And it takes people free up into a designated nature park, nature site, moderate nature trail. And you're given a picnic. You're able to just spend time outside, outdoors, taking in nature and enjoying that outdoor space. And I wanted to share a few photos with you. This is an example of what the bus looks like. And so she wanted to speak to our operators about coming to pick up your residents from your facility to take them out to one of the nature parks throughout Los Angeles County. This would be about a 5-hour trip. Lunch is free. It's included. You can have the walker. If you have someone in a wheelchair, you just need a staff person to accommodate them to push. Elizabeth has about 10 staff members. And so the bus can accommodate 40 non-staff members. So if you've got 40 residents and your own staff members, that'll join Elizabeth's 10 to produce a great day trip. And so we're talking about parks throughout LA County. They would come, they need the space to get in front of your facility and also turn around that bus. And so depending on just logistics, they would get there. They have a lift. And so it's an ADA compliant bus, of course. And the pickup time is around 8:30 in the morning. And sometimes she can provide a little breakfast morning snack, but then you're taken out with your residents to the beautiful outdoors of Los Angeles to enjoy. You have lunch there and then you're brought back to your facility. This is free. And so Elizabeth was going to join us to talk more about this particular excursion opportunity. And so I just wanted to read with you Nature for All's mission. Together we can achieve environmental justice, increase equity, and provide more access to nature for our diverse community. So she has apologized for the last minute, but her colleague called in sick, and so she's out with the group right now, out in nature, and so she will most likely join us in July. But if anyone is interested, please let me know. I think this would be a wonderful resource for our members, a free resource, and a great resource for the residents to enjoy more outside and outdoor space with nature. So please let me know if you're interested in more. But we're going to have Elizabeth join us again to talk a little bit more about the details. But again, this is about a 5-hour day trip for free and can accommodate up to 40 people. That would be your residents and staff plus her 10 to go out and enjoy nature and a free lunch picnic outdoors. So we'll have her back for sure. I wanted to move on. Does anyone have a question about Nature for All? And if not, we can definitely have her back. Elizabeth would come back, but I definitely wanted to move on to LARCA member feedback. This is a discussion time for when all things that are urgent, immediate, new have come. We want to bring it to the attention of our membership. And we recently were informed, and I've been called by two members now, about some concerning changes with HealthNet. This is very, very concerning. I don't know if anyone else is aware of this, but right now on the phone, on our line, we have Eaton, one of our members, and we also have Aaron. And so unfortunately, Eaton and Aaron have been contacted by HealthNet for changes that they were told would go into effect in the fall. And this could be devastating for their facilities. And we aren't aware of any other facilities. So if this is something you have been, you know about, please share. But at this time, Eaton, if you are there and would like to share with our membership what is going on with regard to HealthNet, please feel free.
Sure. Hi. Thanks for having me on today. So we got a concerning call last Thursday from somebody at HealthNet letting us know that they're not renewing their contracts with Concise. That contract is going to end in August, and then Connection and Libertana in September. So we've been trying to reach out to Justice and Aging and some of the care coordinating agencies, just to find out, what they've heard. And some of them weren't aware on their own that they were being terminated, that apparently we found out before they did. So I reached back out to HealthNet, and they confirmed that it seems like they're no longer going to be participating in the ALF transition community support. And they're not going to be adding any new care coordinating agencies to replace those other ones. They're not bringing it in-house, and they're not going to partner anything. There's not going to be any type of continuum of care like they're supposed to be if they choose not to participate in the community support. So from what I understand, the department was not aware that this was happening. So we've made them aware, and we're trying to find out from HealthNet if they're really not going to abide by the policy guide, which says that they need to offer a continuum of care, or if they're going to walk it back and say, oh, you know what, we realize we're making a mistake. We are going to have some type of plan for your current enrollees. So at this point, we're not really too certain, and it's very scary because, if this is what's supposed to be replacing ALW, this is really what's keeping our facilities alive. Because just the SSI rate is not nearly enough to pay for all the care costs and all the other costs that it takes to, really give our patients a dignified way of living. So I don't, this is day by day, we're learning a little bit more, but it seems like it's going to take some time. HealthNet is a private company, so they are in the business of making money, and it seems like this community support is losing the money, so they no longer want to participate any longer.
That's really interesting, Eitan. And I know, Aaron, you too have gotten a call. And if you would like to share anything else, yeah. So, and Gender, and thank you for being here as well, Gender. Your chat note said, so HealthNet is no longer working with Libertana and Concise. And that's what you were told, right, Eitan?
Yeah, on the phone and on the email, yeah.
Okay. And Aaron, thank you and welcome. Would you like to add anything?
Yeah, so basically we got a call from a HealthNet membership service, and they basically told us that we need to move the resident out, the residents that are under HealthNet, and we could put them in a hospital, nursing home, or in a shelter, and that after October 7th, they will no longer be paying, and we need to transition them out of our placements. So this, can you imagine, these are probably hundreds of members all across all of our assisted livings. I mean, I don't know what's going to happen with everyone and what our plan is going to be. And, I mean, we can't fill up hospitals and nursing homes and shelters with these residents. So we need DSS's help. We need everyone's help to really, really ring the bell here and to figure out what are we going to do with all these members, because they cannot go to the streets. That's not an option for them. They cannot go to hospitals, and most of them don't need the higher level of care. That's why they're in an assisted living setting.
Yeah, this is really, really concerning. And I know, Shaji, from Community Care Licensing, you're on with us. I don't know if you guys have been contacted or notified of this at all. And I know that we want to learn more about this. And so has anyone heard about this at all? We definitely want to share this and bring this up to the Department of Healthcare Services as well as the Department of Managed Care. But this seems like this is going to be devastating to our industry. And so this is definitely something that we need to get more information on and collectively work to address this. So Shaji from Community Care Licensing, if you are there, have you heard anything at all about this?
No, this is Shaji from Community Care Licensing. Yes, we haven't heard anything, and I checked with Araceli. She doesn't know anything, but I'll research and find out. Maybe I can share it later.
Thank you, Shaji. We can get some of your guys' help, because again, we don't, what are we going to do with all these residents? We can't put them on the streets. That's not an option. So HealthNet is telling us to do that. I know we have standards and we have regulations, but that's not an option. So we really, really need help. And, we can't have, health net calling communities and telling them, facilities, letting them know that they should be, exiting them out and putting them in shelters or unlicensed, placements. That's not acceptable. So we really, really need help from everyone to ring the bells here.
Yeah, we're going to work too and see. Have you heard from DMH at all on this? Aaron, have you heard from DMH?
No, I have not.
Okay. And I don't think, Eaton, you have either. So I know Benny and I are definitely working with all of the agencies at the state and local level to find out more, because it seems like this is such a sort of ambiguous, right? It's not fully in writing, but you're being emailed or you're having a conversation with. So we don't have anything formal, but that's what we're working on now to understand what exactly.
I have the email that I had sent you. It's
yes,
pretty much,
yes.
where they put it in writing. You could share with them. That's fine. But yeah, they said DHCS was not aware. In the policy guide, it says that they need to give them 30-day notice. And we're a little ahead of the 30-day notice, but they definitely have to have some type of plan for all their patients. And the plan can't be, discharge them to the streets or to a nursing home. That's not a plan.
We will find out, and we will definitely stay on top of this, Eaton and Aaron, and we'll share this with the entire membership in terms of what are the next steps. I mean, just a 30-day plan isn't really good for anybody when you're thinking about saying your only other recourse is to move them into a skilled nursing facility or some kind of temporary shelter. So we will follow up and keep everyone apprised of this. But if anyone hears more about this, please let us know. We're collecting information and reaching out to our government agencies to find out exactly what is happening and what is the state's plan to address this.
Thank you.
Thank you. And was any other member like to share any updates, anything, feedback regarding ALW, CalAIM, ERC? I know several of our operators were chosen for CCE, OSP. So hopefully that has brought a slight improvement in terms of your reimbursement rate and also the amount of care you're able to provide. So we just wanted to hear back from anyone as far as how their operations are going and what information they want to share with us about their facility or their residents. Do we have any members who'd like to just give us any feedback or share what's on their mind? Okay. Well, I thank you very much. And Barbara, thank you so much for your comments and for holding this space. We definitely will continue to do this every month. And I thank you for your comments as well about moving into a skilled nursing facility is not possible since all referrals to SNFs have to come from inpatient hospitals, as I've understood it. It also shelters and interim housing cannot accept the people who are on medications. Yeah, that's why this is all so confusing and very concerning that this is what HealthNet's, suggestions are. So we'll stay on top of this to find out, because as contracted with the state, they have to have a plan. And this is definitely not a plan that I would see is acceptable by the state. So we will stay on top of this and continue to keep you all apprised of what we find. And Benny, did you have... It's
very concerning also, because if HealthNet gets away with this, Anthem and, and LA Care might be like, oh, well, if HealthNet doesn't have to, they might set the precedent and everyone could just leave if there's no real,
And it seems antithetical to the state's, statewide goals of improving care, using those contracts with the managed care plans and BHSA dollars to improve care, to reduce disparities, to address and tackle the crises that we're having. So this seems to be the complete opposite of that. So, and so many people have HealthNet. Is that your largest managed care plan, Ethan?
Yeah, that's for us. Yes, that's one of the biggest.
And yours as well, Aaron?
Yes, by far, because they are the easiest ones to work with up until now.
Okay. Yeah. So we will certainly follow up. And I thank you so much. And if there's anything else you'd like to share, Eaton or Aaron, about this?
No, just reach out if you have anybody in mind that you think could help us out. Just it's worth a shot. Justice in Aging is trying to help, but the more people that speak up, I think the more urgency there will be. There's power in numbers.
Absolutely. I agree, Eaton. And that's exactly what we're doing. So we will be sure to follow up because this would be very, very devastating in a system that's already complicated and fragmented. So thank you for sharing this with us. And thank you all for joining us today. It's nice to welcome back a few of you and welcome our new folks as well. We've got about 6 minutes that we're going to give you guys back, and we'll be sure to send out the deck. We're also working with our state legislature because obviously this is a state issue. And so our state assembly, our state senators, they serve on joint committees for health. There is a select committee on the mental health crisis, and that's in the assembly. So we will be reaching out and working with our elected officials as well to ensure that they are aware of this. And thank you also, Chris. We appreciate you for joining us, and thank you all for joining us again. Any additional information, feel free to email me or call me if you want. We'll see you next month, if not before, and we'll provide those updates with you as soon as we have them. Thank you all again.
Salaneka, I just wanted to tag on to this. Please, for facility owners and managers, don't forget the family members. They vote and they are concerned. They may not be showing up, in a way that you can see them, but don't forget to enlist them in advocacy because they're there for you if you ask them. Many of them ask me all the time, what can we do? We want to help. And they don't know. So this is an area where they could help. They could write letters, even if, they're 85 years old. They can write a letter to their state assembly member. And they may be 85 years old and they can't take care of their loved one by themselves. That's why you're important to their lives. So be sure and enlist the people that you don't see but are also heavily invested in your survival.
Thank you so much, Barbara. That is an excellent point and excellent feedback to add, and we appreciate that. Definitely the families play a role, and as Eaton said earlier, there is strength in numbers, and they are definitely a significant part of those numbers. So thank you. Yeah, we've got so much to do, and we thank you all. We'll let you guys get back to your day, but we will follow up with you soon, and we look forward to seeing you soon. And for Michelle, we will connect directly so we can bring the information to you for your facility about Lisbeth. But we definitely plan to have Lisbeth join us next month as well to talk more. But this program, if anyone is interested, again, in day programs for your facility for the nature and lunch, please contact me.
Thank you.
You're welcome, Michelle, and you all enjoy the rest of your day. And thank you for all of your questions and your feedback. This has been an excellent session and just really, really great information. So we thank you all, and we look forward to seeing you soon. Take care.